Hi everyone, Dr. Nemechek here. I want to share with you the results of my recent eye exam I had. And, most of us, we go to the eye doctor, to get our glasses checked and get our prescription updated. There's so much more going on there, okay? And if you ask the right questions, or actually I think you got to go to the right optometrist who has the time and inclination to share all this with you. You can learn a ton about your health. So first, just simple diagram. Okay, here's the eyeball. Here's the optic nerve and the blood vessels that come in from the brain. All right. We've got your lens here, cornea. And so we're going to be showing pictures as we look in and show the back tissue here, called the retina. But when you go to the exam, they do that little puff test. They can look for glaucoma and the pressure, see if you're building up tissue here, if you need cataracts or something. I mean, that's typically if you're older. But the most important stuff really is happening in the back, okay? Now, this is a picture. What I'm going to show you next is a picture of looking in. You're going to see what this back area looks like. And that's this. So I showed you the optic nerve coming in. That's the optic nerve right there. It comes in and it splays out, and that turns into the retina. All right? Your retina are brain cells, okay? Growing out there, connected with the optic nerve. All right? And then this dark spot is called the macula. And so if anybody's heard of like macular degeneration and stuff, this is where your problem's happening here. All right. 90% of your vision comes out of there. That's why you have a little bit of a problem here, tons of vision problems because it's 90%. And then you have these lines here, these dark lines, these lighter lines, these dark lines, that's your arteries. These other ones are your veins. All right. You can learn tons about your health here, okay? And when I come away from my exam, now this is my my image from 2020, but it just went last month. It looks just as good, and actually my vision got a little better, believe it or not. And I'm just so excited because I can see with my own eyes the health of my blood vessels and my nervous system, okay? And so examples of what goes wrong here is if somebody has diabetes, these blood vessels can actually rupture and you get a hemorrhage here. You have big blotches of blood all around, okay? Not a good thing, obviously. If you have high blood pressure, I'm going to boost this up. High blood pressure, where the arteries and the veins cross, so where the light and the darker blood vessels cross, like here, you would get what's called AV nicking, arterial venous nicking. And then what that means is it looks like an hourglass narrowing. You'd have these little narrowed spots. And look, I don't have any there. I don't have any there. With these cross, I don't have any there. And so that means I have very, very healthy blood vessels, okay? Often the AV nicking is occurring early in cardiovascular disease, so think strokes or heart attacks, hypertension, chronic kidney disease, you're going to see this stuff. The other thing is you can literally see cholesterol plaques in these blood vessels. Now, it doesn't really come across well here, but when you're the doctor looking at them or looking at the images in the doctor's office, these images are three-dimensional. You get it. It looks like a garden hose just running across the ground. You can see the roundness of your vessels. Okay? It's fascinating. All right? So you can see now, so your blood vessels and how different metabolic diseases will affect them. And then neurologically, you can see things. So they'll see some trouble here, like with the macula and so forth. And what they'll do here is we can take and you can scan and look at the thickness of it. So here's the retina. So this is the surface, and this goes deeper into the eyeball. And so here is the macula, that dark spot, and this looks all super healthy here. But this is what they're doing when they start seeing some bubbling up in here. That tells you have wet or dry macular degeneration or so forth. My wife Jean a couple years ago was showing up some dark area that was indicative of oxidative stress, that she needed more antioxidants. So we bumped that up, and within a year and a half, it completely reversed and normalized. And that may have easily turned into macular degeneration in her in the future. Okay? Super important. And then another very interesting thing that's happening is you can get these little white things. They almost look like little white sesame seed shaped things out here. Okay? And they're called Drusen. Drusen. And these are the same things as getting a plaque for Alzheimer's in your brain. The more Alzheimer's plaques you have, the more likely you're going to have, or the more severe is your Alzheimer's. We now know the more Drusen you have, the more likely you might be developing Alzheimer's. Now, there are ways to stop that whole process. So who wouldn't want to see it first? Basically, remember, this retina is brain tissue, okay? Who wouldn't want to see that happening first? And then, like, what we do is we can put people on our protocol, which dramatically drops the inflammation. They'll clear up and go away. We've had some customers. Now, I go to, and if you're in Southern California, or if you want to take a trip to the beach, Laguna Eyes Optometry in Laguna Beach. That's Laguna Eyes Optometry in Laguna Beach, and Dr. Alicia Harrison, phenomenal, brilliant. The Harrison family are a bunch of brilliant doctors, and she can run through this, and she actually in her program will count the Drusen. And if they're going up, we do more. We help lower the inflammation so we can start reversing that process. Okay? So, sure, it's very important to have proper eyewear, the correct prescriptions, have eye strain or headaches or things like that. But if you push a little more, maybe go to a different kind of doctor that does the scans, you can get a whole lot of information about your health. So I just wanted to share that with everybody, and I hope you enjoyed that. Otherwise, everybody, have a good day. Take care now. Bye.